Joining us now to talk about how the health insurance industry may have shot itself in the foot with this report is Democratic Congressman Anthony Weiner of New York. And Congressman Weiner, it's nice to see you again.
It's my pleasure. Thanks.
Congressman, first of all, the report assumes no behavioral changes whatsoever in response to the new proposed policies. That seems like a dead giveaway that this report is flawed, but what's your view?
Well, the one behavioral change we're clearly not going to see is the insurance companies aren't going to suddenly start saying, you know what, we're going to stop making 30% profits and cut it down to 10 or 5 because of this bill. You know, they unwittingly did this, but they made the single best argument I've seen in a while for why you need a vigorous competitor for the health insurance industry, namely the public plan. They're freely saying that it doesn't matter what you guys in Congress do, we're going to keep raising our rates. You know, there is a word for this. It's called chutzpah. They are right now on the eve of this vote saying, you know what, since you didn't put a public option in, we're going to raise our rates in their own calculation by 111%. They really do seem to have no shame about the way they proceed, but many of my colleagues saw this report and are responding in exactly the opposite way that I think the insurance industry would respond.
And these are colleagues of yours who may have been on the fence as far as trying to rein in the for-profit insurance companies?
Well, you know, a lot of us are wondering what's going on here. Here it is, we're giving the insurance companies millions of new customers because we're going to require people to get coverage, and their way of saying thanks is on the eve of the vote to say, you know what, you can do that, but we're still going to raise rates. But the fact that they're going to raise rates is actually a rare moment of honesty for this industry. They're saying clearly that unless they have some competition, they aren't going to contain costs themselves. You know, I started a website, countdowntohealthcare.com, where we were using it to put pressure on some of the more moderate members of my party, but we're going to circulate this healthcare report as an example for why you need the public option.
Well, Congressman, tell us a little bit more about the website, countdowntohealthcare.com. I mean, how is the effort going to try to reach out to conservative Democrats?
Well, you know, it's going fairly well. I mean, it's remarkable the amount of energy there is. You know, we think that many of these moderate districts, people don't favor health care. We're learning quite the opposite. A lot of the reasons why Democrats got elected in these so-called swing districts is because we committed to doing something about the high cost of health care. And the numbers of people that are signing up who are saying, you know what, I'm from a blue dog district, or I'm from a Republican district, and I want health care, has been quite profound. You know, at countdowntohealthcare.com, every day we kind of do a wrap-up of the day's events, and we put up reports like the one that you led this story with about children being denied coverage because they're a little bit overweight. This is why we need competition.
The Rocky Mountain Health Plans reversed their decision today and decided to cover that baby when, quote, a recent situation in which we denied coverage to a heavy yet healthy infant brought to our attention a flaw in our underwriting system. Is this what reform would look like if the insurance industry had its say, a change in policy only when they're shamed into it?
Well, you've got to understand how the health insurance industry works. And they're not venal people, but they want to take in as much money as they can and pay out as little as they can for health care. That's what their shareholders demand, and that's what they're rewarded for in the marketplace. The problem is that's exactly the opposite of what we in Congress should be advocating for. We should be advocating for as little as possible coming out of consumers' pockets and as much health care coming out of that. So that's the conflict that we have in the insurance industry today. Loud and clear announced, you know what, we don't care what you do in Congress, we're going to keep raising rates, which is why if we don't have a single payer plan like Medicare for all Americans, which is something I would support, we at the very least have to have some form of competition in order to keep them honest. If just being a heavy baby is a crime, my niece Reeve, who turns 18 months today, would probably have to be locked up because she's a little bit portly, but that should not be what health insurance industry does.
The White House has been fairly critical of the health insurance industry, but publicly the industry hasn't fought back. They've been trying to portray themselves as partners, not adversaries. Is something very different going on in the halls of Congress now?
Well, you know what? The health insurance industry so far has gotten a lot of what they wanted in the Finance Committee bill that's going to be passed out tomorrow. They didn't get a strong public option. There's very little true cost containment in there, and they got the requirement that more customers will be driven to their doorstep because there's a mandate for coverage. And when we've tried to do even the most modest form of a public option, they have fought back vigorously. Look, there's no doubt about it. When you consider that hundreds of billions of dollars each year don't go into health care, they go into health insurance company profits. When we do nothing to compete, to make sure that they compete in the pharmaceutical industry, for example, so we get the lowest prices just like you might get at Walmart, they don't want any of those changes to happen. And frankly, that's where Congress has to get a spine and stand up to these industries.
Congressman Anthony Weiner, Democrat from New York, a fierce advocate of the public option, even single payer. And Congressman, thanks for your time today. We appreciate it.
It's my pleasure. Can I say the website one more time? It's
Sure.
countdowntohealthcare.com.
Okay.
Thanks.